it is a beautiful topic because there's a lot of stigma about anxiety. How many of you are agree with this? Lot of stigma. That anxiety, I can't tell anyone that anxiety is, I have anxiety, or I'm taking some benzodiazepine, and people feel that this is all related with the brain health only. Do you agree with this? Do you agree with this? That lots of stigma related with treating anxiety. So we'll be I'm saying decoding anxiety from the functional psychiatry or the precision psychiatry point of view. कि आपने कभी सोचा भी नहीं होगा कि साइकियाट्री और एंजाइटी का मतलब आपकी बॉडी और माइंड कनेक्शंस भी हो सकते हैं. So today we'll be decoding these connections. So I'm able to see many names here. Mr. Kasfan Khan. Many people are here. Thank you for being here. And today we'll be discussing something different that you haven't heard before. And it is a promise जो आपका thought process है anxiety के बारे में या mental health के बारे में, आज वो बदल जाएगा. Are you ready for this? Would you like to change your thought process about anxiety कि anxiety अकेला brain से related ही नहीं है. It is somewhere else. Would you like to change the thought process? If yes, type yes in chat box. So we are starting now. So first of all, we need to understand what exactly is anxiety. Anxiety एक natural response है. And second, anxiety is a disorder also. सबसे पहले हमें समझना है कि anxiety natural response कैसे है और disease में कैसे है. So अगर मुझे कोई ये कहे कि anxiety किसी ने experience नहीं की है, is it right or wrong, including me? So everybody experiences anxiety in their lifetime. Whenever stress is there, first of all, we should talk about anxiety develop कैसे होती है. Okay? So कभी भी कोई stress आता है, हमारे brain में एक छोटा सा एक part है amygdala. वो एक्टिवेट होता है और जब वो एक्टिवेट होता है amygdala, तो हमारा जो सिंपैथेटिक सिस्टम है वो फायर करता है और amygdala को लगता है कि थ्रेट आ गया. फॉर एग्जाम्पल, आप किसी गार्डन में ही हैं, कुछ डॉग्स आपके पीछे आ गए तो amygdala एक्टिवेट होता है, आप एंग्शियस हो जाते हैं, समथिंग बैड में हैपन. सो इज इट अ नॉर्मल रिस्पॉन्स और एबनॉर्मल रिस्पॉन्स? It's a normal response. Everybody experiences this because our body perceives threat. हमारी body को ऐसा लगता है कि something bad may happen and we need to run. This is called fight and flight response, and we all experience this. So anxiety is a biological response. जब भी stress या threat हमारे सामने आता है, amygdala एक्टिवेट होता है, हमारा प्रीफ्रंटल कॉर्टेक्स जो यहाँ है वो कहता है चिल भाई, देयर इज नथिंग लाइक दैट, नथिंग इज गोइंग टू हैपन. और यही स्ट्रेस जब लंबे समय पे रहता है, सो हमारे सिंपैथेटिक और पैरासिम्पैथेटिक नर्वस सिस्टम में एक इम्बैलेंस आ जाता है. सो दिस इज अबाउट एंजाइटी एंड द बायोलॉजिकल पार्ट ऑफ द एंजाइटी. अब बात करते हैं कि एंजाइटी डिसऑर्डर क्या है. So I feel everybody has experienced anxiety. So many of you are here. Can you type in chat box? All of you have experienced anxiety any time in your life, exams or any time. So that's a biological mechanism of fight or flight response. That's clear? Now let's talk about disease. What's the difference between anxiety and disease, anxiety disorder? First of all, we need to understand कोई भी disorder या disease हम तब word use करते हैं जब उससे हमारा रूटीन, हमारा वर्क लाइफ बैलेंस अगर इम्पेक्ट होना शुरू हो गया, yes, definitely it is called disorder. Agreed? So far agree? Okay. So whenever anxiety response is so much, you are not able to concentrate, you have excessive worry, and sleep gets disturbed, energy levels gets depleted. Yes, now it is called disorder. Clear so far? Okay. So today we'll be discussing about generalized anxiety disorder, जो most common anxiety disorder है. So generalized anxiety disorder means something एक्सेसिव वरी हो रही है, छोटी छोटी बात की फिक्र रहती है, मेरा लोन उतरेगा नहीं उतरेगा, क्या होगा आगे. मीन्स नेगेटिव repetitive thoughts, routine worries. They are rational. They are rational thoughts that are repetitive, negative. आपको पता है कि with time things will get settled down, but you're not able to control. Now, since the thoughts are negative, emotions are negative. Since the emotions are negative, the behavioral outcome is negative. Thinking, emotions, and the behavior. So there is an anxious response because of that. Right so far? हाँ. और हम लोग समझते हैं कि जो ये हो रहा है, it's all because of the stresses and the body connection. That is again fine. But today, stay till the end. We'll be discussing about something more than that. जो आप लोगों की परसेप्शन है एंजाइटी के बारे में, स्ट्रेस एंड वरीज. आप यही समझते हैं, स्ट्रेस हुआ, वरीज हुई और एंजाइटी आई. क्लियर? सो फार क्लियर? Today I'll be decoding something more than that. Stay till the end and you will get something more than that. कि क्या आपकी बॉडी भी माइंड को अफेक्ट कर रही है, and definitely it is affecting. So in the future, slides, we'll be discussing like what exactly, the gut-brain axis or your hormones, your nutritional deficiencies, how these are related. Let's talk about diagnosis first, okay? So we psychiatrists use certain tools to assess the anxiety. We go for clinical interview also, and at the same time we think about functional psychiatry. What is functional psychiatry or the precision psychiatry? That is not one size fits to the all. In conventional psychiatry, what we do is, हम क्या करते हैं? We give some medications for the anxiety. We go for blood tests like thyroid, B12, D3, basic things, and counselings. We focus on these tools. In functional psychiatry, this is a precision psychiatry. Means body का mind पे impact क्या है? We work on that. So usually psychiatrist क्या करता है? एक clinical interview रहता है और assessment, कुछ assessments होती हैं, and we just go for the clinical diagnosis. And thereafter, the new, approach is functional psychiatry, where we discuss and we think about, mind and body connections and how your hormones and the gut health and the nutrition is causing anxiety. Now, the most important thing which you need to understand, first of all, anxiety भी different types की होती है. The first of all is generalized anxiety disorder. This is सिर्फ excessive worries. If it is panic disorder, extreme anxiety होगी और patient को लगता है कि I need some emergency medicine immediately, otherwise something bad may happen. This is panic. One is social anxiety. Social anxiety is something they are avoiding people. So personality issues, like they can't handle stresses. So stresses unse handle nahi hote, that's why. So one is psychological or psychiatric differential diagnosis. Today we are discussing more than that. Okay, people are thinking about labels only. This is panic, generalized anxiety disorder, or panic disorder. They are thinking about labels only. Today we are discussing more than that, how your body is impacting anxiety and your stress response. And the beauty of this kind of approach is अब जब आप डिफरेंशियल डायग्नोसिस करते हैं, एंग्जाइटी डिसऑर्डर है या पैनिक है, जनरलाइज्ड एंग्जाइटी है, व्हाट एग्जैक्टली यू आर डूइंग? स्टिग्मा. यू आर क्रिएटिंग लेबल्स. एंड वंस यू कम टू नो कि इस एंग्जाइटी के पीछे कुछ मेडिकल कॉजेज में है, इज इट डिक्रीजिंग स्टिग्मा? And the second question is it giving some other tools to you to manage anxiety that majority of people ignore? Now, let's talk about hormones. If you have subclinical hypothyroidism, still you may face anxiety. If you have hypothyroidism, you may face anxiety. If you have hyperthyroidism, you may face anxiety. Interesting. And majority of the people just keep blaming themselves. And this is the most common scenario I'm observing in clinic. Isko samjha do, isko bata do, and they never think about that their body might be impacting all this. This is the most common scenario which we observe. Now, other is all other hormones. If you talk about other hormones, your diabetes, your obesity, it's all related. You manage your obesity, your anxiety will decrease, your personality will improve. Is it something new? Is it something new? Okay. Now, other part is your gut-brain axis. We will cover gut-brain axis later. The neurotransmitter imbalance. अब जब amygdala, जब कोई थ्रेट आता है, कोई स्ट्रेस आता है, एमिगडाला इम्पैक्ट होता है. जब एमिगडाला इम्पैक्ट होता है, आपका ब्रेन का वो एक छोटा सा टाइनी एक स्ट्रक्चर इम्पैक्ट होता है, वो आपके स्ट्रेस रिस्पॉन्स को अफेक्ट करता है. और जब स्ट्रेस रिस्पॉन्स यानी HPA एक्सिस, हाइपोथैलेमस पिट्यूटरी एक्सिस इम्पैक्ट होता है, तो व्हाट हैपेंस देयर, आपके एड्रीनल से कॉर्टिसोल ढिया हार्मोन का सेक्रीशन अफेक्ट होता है. और जब वो हार्मोन्स इम्पैक्ट होते हैं, आपकी बॉडी में इन्फ्लेमेशन आती है. सेकंड, स्ट्रेस अगर लंबे समय पे रहता है, आपका डाइजेशन ही गड़बड़ हो जाता है. दिस इज हाउ एंजाइटी इज इंटरकनेक्टेड. दिस ऑल थिंग्स आर हैपनिंग. ना, ये तो हो गया जी बायोलॉजी. लेट्स टॉक अबाउट नेचुरल थिंग्स. हम कर क्या सकते हैं? ओके. The last thing is, अगर there is a category insulin resistance, and in insulin resistant what is happening, कई बार आपका ब्लड शुगर लेवल बढ़ जाता है, कभी आपका ब्लड शुगर लेवल डिक्रीज हो जाता है. और जब ब्लड शुगर लेवल इंक्रीज होता है, डिक्रीज होता है, सर्टेनली वो भी एंजाइटी से रिलेटेड है ना. पीपल कंटिन्यू काउंसलिंग्स 6 months, 8 months, 1 year. नाउ दे से एंजाइटी सेटल नहीं हो रही है. They blame themselves. They're not thinking about mind and body connections. They just keep on blaming themselves. Okay, this is all anxiety. I am the person. This is the stress responsible. Either they're blaming stress or they're not thinking about there could be some other factors also. And these other factors are gut. आपका मेजॉरिटी ऑफ सेरोटोनिन, हैप्पी न्यूरोट्रांसमिटर्स आपके गट में बनता है. सेकंड, इन्फ्लेमेशन, हाई इन्फ्लेमेशन इन द बॉडी, दैट इज रिलेटेड टू द साइकियाट्रिक डिसऑर्डर्स. ब्लड शुगर इम्बैलेंस, इट इज ऑल रिलेटेड टू दिस. Now, after taking, sometimes we observe hormonal imbalances are there and they're just continuing counselings because they don't want to take the medication. At the same time, if they have this insight and if they have this missing piece of knowledge that your blood sugar imbalances, your hormonal imbalances, the inflammation, your gut, your microbiome, everything's related to your symptoms. Would you like to work for that? Isn't it amazing? So, psychological approaches, certainly cognitive behavior psychotherapies are there. In cognitive behavior psychotherapies, हम लोग करते क्या है? जो भी thinking patterns है, for example, there are certain negative patterns, something bad may happen, उसका restructuring होता है, and the psychologist or the therapist work on that. Second, exposure for the fears. For example, do you go to the swimming pool? स्विमिंग पूल में अगर आप जाते हो तो पानी ठंडा लगता है. उस स्विमिंग पूल में जाने के 1 घंटे बाद, 1.5 घंटे बाद क्या वो पानी ठंडा लगता है? द सेम स्टोरीज विद दीज फियर्स. अगर उसको रेपिटेटिव एक्सपोजर होता है, थेरेपिस्ट ग्रेजुअली उसको एक्सपोजर ग्रेजुअली कराता है, ये सर्टेनली टू सम एक्सटेंट वो फियर्स जाने शुरू हो जाते हैं और बिहेवियरल मॉडिफिकेशन शुरू हो जाती है. तो दिस इज हाउ सीबीटी हेल्प्स. Still, CBT works for very 40 to 50% of the cases. Even after CBT, people, say that, results are not there. Then there's a need to think about the other connections, the microbiome, the inflammation, the gut health, and the hormonal imbalances. This all are interrelated. And you need to think like this. For example, this is the baseline and somebody is coming with a symptom. ऐसे करके. One is taking medicine for that and doing the counselings for that. Fine. Now they're doing the conventional strategies and they're not getting results. What could be the other layers? Just for touch karke they can get the results. The first layer is the biochemistry that we have just discussed. The biochemistry means gut health, hormones, nutritional deficiencies, inflammation. The other layer is, usse niche jo layer hai, your nutrition and lifestyle. The last layer is your belief system. So to get very good results, there's a need to work on all the 4 layers. So how many of you are ready to go for all these 4 layers? And is this concept reducing the stigma that this is the only brain which is responsible for this? Clear so far? Now, there are mind-body techniques that give very good results in anxiety. One is deep breathing exercises. That's one of my favorite. This is very simple. You just need to inhale 1, 2, 3, 4, 5 and abdominal breathing. Take a pause and exhale. This activates your vagal tone. And for your gut-brain connection, your vagal tone is the most important thing. You need to develop that muscle. That's why deep breathing is really, really beautiful for that. Other is grounding techniques. There are various grounding techniques. Would you like to experience one grounding technique with me? Do one thing. Observe 3 objects in front of you. Observe 3 objects in front of you. Any 3 objects. And observe 3 sounds that you are observing. Any 3 sounds. 3 objects, 3 sounds. Now, go for 3 body movements. 1, 2, or anything, leg movement, 3. It will give you temporarily distraction from the anxiety. This is called grounding. Definitely gratitude practices, it changes everything. It takes your brain from beta waves to alpha wave. Beta wave means you are highly anxious and the brain is running fast. And the moment you will start practicing gratitude, certainly you will be relaxed because your thinking patterns changes. And once you will be able to change your thinking patterns, emotions will improve. Once emotions will improve, definitely anxiety will reduce. So let's talk about functional or precision psychiatry. This is my passion, healing minds with integrative nutrition. Because whenever I get results, particularly with the medication-resistant cases with the functional or precision psychiatry, this is something beautiful. It includes anti-inflammatory nutrition, healthy fats, anti-inflammatory diets, high-protein meals. Why high-protein meals? Anyone? Why high protein meals? Because high protein meals stabilizes your blood sugar. At least your early breakfast should have good protein. Gut healing also reduces anxiety. Now, stop the sugary breakfast, switch to the protein based diet, at least in breakfast. It will stabilize blood sugar and it will reduce anxiety. So, and before this announcement, I would like to show you something else also. This is by Harvard Health Publishing. That this is the how nutrition is so important for the mental health. So important for the mental health. Simple micronutrients, and they are so essential. And when your gut microbiome is not good, this is not now research. We are experiencing in our clinical practice also. People who have good digestion, yes, they are doing far better than people who have digestive issues. And medication resistant cases, they are improving once we start working on the gut brain axis. Okay. So if you want to understand more about this, this is the book we published last year on Amazon. This is Missing Links, Why Medicines Are Not Working for You. It has covered all these mind body connections. So you will get the clarity. I think I was not able to show that book also. Give me. I was not able to show that book. This is, first of all, just go through this anxiety, disorders, and obesity, how this is interrelated. You just reduce obesity, you will start getting improvement. As well as obesity, the side benefit is you are working on, you're managing obesity, and the side benefit is you are getting rid of the anxiety. And now I'm coming to the missing links. And if you want to understand more about, how mind and body connections are interconnected, you can go for this book. This is The Missing Links, Why Medicines Are Not Working for You. This is particularly for the medication resistant cases. And we are doing programs also for the medication resistant cases, and very good results once we start working on this mind and body connections. So with this, I want to close this session, and I'm open to your questions. If you have any questions, Mr. Kaswan, this is Divine Trust. Anyone who have any question, please type in chat box. No questions? Okay, I have one announcement only for physicians or the doctors or the psychologists, whosoever, any professional, if there is in the audience. We are conducting one workshop in the second week of the May about the anxiety treatment mastery. This will be about the diagnosis and differential diagnosis, gut brain size, and how to control inflammation, and the functional protocols, supplements, and amino acids, and mind body therapies. And after this live session, you will get a link before this video, and you can book one clarity call or any query related this workshop. My team will coordinate, and you can join the joining list for this beautiful workshop. This is anxiety mastery workshop related to integrated approaches. We might be discussing supplements like one of my favorite supplements like taurine, inositol, L-theanine, how to use all for inflammation and anxiety. Definitely, it should be under supervision of the professionals, and particularly professionals, psychologists, or any physician or doctors or other health professionals. If they're interested, join us. next week for the workshop. With this, I would like to end the workshop. If you have any questions, any diagnostic tools, yes, let me answer your question. Let me answer your question. Give me 1 minute. Okay, so the diagnostic tools, simple. There are two diagnostic tools which we psychiatrists use. One is the clinical interview. Clinical interview is the most important thing, because one of the major mistake which I'm observing is people are not able to differentiate between personality issues and the anxiety disorders. They sometimes treat personality and the anxiety disorders with the same way. Okay, so they need to understand personality assessments also, and the mood assessments, as well as anxiety disorders. So in our workshops, we are doing this differential diagnosis also, because for the professionals, this is really important to understand all the diagnosis and the differential diagnosis also. Second, other, if you want to use, meanwhile you want to use certain tools yourself, there are certain tools like GAD screening tool, Hamilton anxiety rating scale. There are many scales who are available, that are available on internet also, and you can download these scales and use it yourself. Very simple. But definitely, if you want to dig deeper and you want to understand the diagnosis and the differential diagnosis, particularly diagnosis and the differential diagnosis, just it's a matter of 1 month or 2 month training only. It's not difficult. Okay. So, any other questions so far? Thank you very much for joining this session. And you are here at 11:30 on Sunday. You have taken time on Sunday. Thank you very much for being here. Thank you.